Why is it so important to have surgery close to home? Patients going abroad for surgery, then having complications, how important is continuity of care? Yeah. I mean, I've got to be honest, we are seeing an increased amount of people who are asking for help having had surgery abroad. And I have to be honest, I do feel bad because I feel sorry for them. But the thing that I always say is that when you're having surgery, when you're trying to choose a surgeon or a clinic or a place to have your treatment, what you got to realize is that the way it works in plastic surgery is that you only have to pay once. So you only have to pay one fee. It's what's called a fixed price package. It's unusual amongst surgery. A lot of surgery, you kind of pay every time. A lot of surgery is insured. So a lot of the work the hospitals do is insured work. And if it isn't, it might be self-pay, but there's not so much of the self-pay packages. Self-pay packages are very common in plastic surgery, but not so common in other kinds of surgery. So in other kinds of surgery, if you have an issue, if you have a problem, and you go back to theatre, then you have to pay again. If you go back and see the doctor, then you have to pay again. You have to pay every time you see the doctor and every time you have a procedure. It might not be you paying, it might be the insurance company paying, but nevertheless, the facility, the insurance, the hospital and the doctor are getting paid every time that they do something. In plastic surgery, it doesn't work that way. It's what's called a fixed price package. You pay once for the whole package of care. And so that might be one of the reasons there's quite a marked price differential for having surgery in the UK and having surgery abroad, and even within the UK, different prices. So you've got to look at what sort of package of care you're going to look for the aftercare, because we get a lot of people who've recently had surgery abroad and are not happy. They don't feel like they're being looked after, and they want to be looked after. And we don't really have a facility for that. We don't have a facility where you can kind of just have the aftercare. Once you've had the surgery, the onus of the aftercare is on the place where you had the surgery. That's part of the package price. And so you can't really have just the aftercare with me, for instance. You know, if you pay for the surgery, you get the aftercare. And a lot of my time is spent looking after people who I've operated on. And we can't really help people who are getting in touch saying, look, I'm not happy with the results of my surgery. Can you have a look and can you help? I mean, I will help, and you can come on here and I'll answer questions. If you've got questions, I'll answer them, and I will help as much as I can. But I won't kind of take on the aftercare, not least because I wouldn't really, you know, I often say, because the people in the office take the calls and what have you, and I often say, like, I wouldn't want another surgeon to be commenting on my patient. You know, if I've got a patient who is recently post-op, you know, ideally you should listen to your surgeon, because there's a lot of stuff which isn't written in stone and a lot of stuff which is opinion, and you don't really want to get another surgeon's opinion which might conflict with your surgeon's opinion. Not that your surgeon's wrong, but it's confusing if one guy says, oh, you need a dressing on that, and another one says, oh, I wouldn't put a dressing on that, get in the shower. It's like, who do you believe? So you're better off, unless it's like wildly crazy what they're saying to you, you're better off really sticking with your original surgeon is the advice. And that is why you've got to look at what sort of facility there is for the aftercare. We find a lot of people seem to have a WhatsApp communication with the surgeons and the clinics. Sometimes when they have a problem, they then get banned from that WhatsApp, and therefore they're left completely adrift without any recourse for help. And these things, from a medical point of view, from my point of view as a surgeon, it's completely unacceptable to ban a patient from a WhatsApp just because they've got a complication. So, you know, it's important. So, yeah, I mean, so the question is, why is it important to have surgery close to home? Well, few reasons. I think it's always good to have surgery close to home because of, as I say, in terms of the aftercare and looking after you, you've got to look at those things. Also, things like traveling. You know, we've had a patient who got in touch yesterday who had a problem with an implant that got infected and then had to be removed, and then they have to have another implant put in, and they don't want to have the next implant put back in abroad. They want to have it done here, and you've got to think that if you need revision surgery, if you need any other procedures, then you're going to have to go back abroad for those procedures. It's difficult to find a surgeon who will kind of take it on at the sort of halfway mark. And if you do find a surgeon that will take it on the halfway mark, they will charge. And so that's something to be aware of, that you're going to have to pay again. Whereas often if you, if it's a revision from the original procedure, something, often they'll be done at a reduced price, or, often no price if it's something that's come about from the that, like for instance the implant removed and put back in. You shouldn't really have to pay for that if your original surgeon does it. So really, yes, it's so important to have continuity of care. It's so important to have good aftercare. And I think it's easy to lose sight of that in the pre-op stages. If you're in the research stage, you might look at the outside and think it all looks good, but you got to think, well, what is my line of communication when I have the post-operative, aftercare? Will I be looked after? Because that is part of what you're paying for. And if you're not paying much, it might be that there's skimpings going on there. There's got to be skimpings going on somewhere. There's no such thing as like best aftercare, best quality, best implants, best operating theaters, best surgeons, and best price. It doesn't all. It's just no such thing. If there was, that would everyone would be doing that. So there's always going to be a compromise somewhere, and it might be that you say, look, I can't afford it, and I'm going to go abroad and all this, or whatever, which is fine, and people do, and lots of people do. So it's not only fine; it is happening quite commonly, but kind of like it's just about perhaps having to accept that if something doesn't go right, then you're going to think, okay, well, I knew that was I knew that the aftercare was going to be an issue, and now I've got to see what I can do. But as I say, you might run into trouble because as a surgeon, it might sound unhelpful, but it's an awful lot easier to kind of get it right first time. I know that's really unhelpful to say to someone who's got a problem. I completely understand that, but I would much rather just do a breast augmentation or whatever, or a tummy tuck or whatever it may be, off the fresh patient, rather than taking on one that they've had the surgery and it's not right and they're not happy and there's issues. That's a lot more difficult to attend to because you've got scar tissue in there. You've got an operation. You might not know exactly what's gone on in it, and it's very difficult. And as I say, personally, I feel bad charging people for it because they're obviously price sensitive because they've chosen perhaps I maybe shouldn't say obviously, there might be other reasons they've chosen it, but often it's a price issue, but not always. But it is difficult taking on patients like that. So I guess the point of what I'm trying to say is just an awareness that what you're paying for is not just the surgery. So if you were comparing one to another, then just bear that in mind in terms of your comparison. Look at how it will run in terms of aftercares, in terms of revisions, because that will go into the value equation of what you're going to be paying for.